Hey, future nurses, let's break down nephrotic syndrome in an easy way to understand. So, we'll talk about the pathophysiology, the signs and symptoms, and the treatment of nephrotic syndrome. So, going back to the pathophysiology, so this occurs due to infection or thromboembolism, which causes injury to the glomerular basement membrane. And just going back a little bit to the function of the glomerular basement membrane. So this is a unit of the kidney which functions as the filtration unit, and it's crucial filtration barrier that selectively allows water and small particles to pass through while retaining the larger molecules like protein in the vascular system. So when there is damage to the glomerular basement membrane, it increases the permeability, which causes more protein to go through and causing proteinuria, which just means increased protein in your urine. So this leads to a decrease in the serum albumin, which is the protein in your vascular system, and decrease in albumin leads to a decrease in osmotic pressure. So osmotic pressure allows for a balance between the vascular and interstitial space fluid. So if there is decrease in osmotic pressure, there is less fluid in the vascular system and there's accumulation of fluid in the interstitial space, and fluid in the interstitial space causes edema. So that brings us to the signs of and symptoms that you may see with nephrotic syndrome. So the hallmark sign is usually edema, so mostly swelling of the legs. You might get ascites, which is swelling in the abdominal region. You might see swelling in the eyes, which most commonly appears in the morning. Then you'll also see proteinuria or high protein in the urine, which also might be foamy or frothy, and that's because of that protein in the urine. Low albumin in the bloodstream, which leads to that shifting again out of the vessels, causing edema. Um, Hyperlipidemia might occur, and this is the body's way of compensating for the loss of protein by producing more cholesterol and more lipids. Weight gain, and that's related to the edema, water and sodium retention. And then blood pressure might be slightly low or normal depending on how severe the edema is. There's lethargy. Some people might experience anorexia, pallor because of that decreased vascular in the vascular fluid. Treatment for nephrotic syndrome will include corticosteroids that helps with decreasing the inflammation. Immunosuppressants just reduces the relapse rate and induces long-term remission. Diuretics like Lasix can help reduce edema. For hyperlipidemia, we use statins to treat that. Some people might get albumin to help with severe edema, and then we monitor daily INOs and weight, just because again of that shift in the fluid from the vascular system to the interstitial space. That's pretty much what nephrotic syndrome is, in a really quick way to understand. I hope this helps. If you have any questions or comments, please leave it below at the comment section. And if you'd like me to discuss a specific topic, also let me know. I'll see you in the next one.